Ever seen someone explode over something tiny? A spilled drink, a slow driver, a joke taken the wrong way, and wondered, what was that all about? Now imagine living inside that person's mind, where anger builds in seconds, where the body feels hijacked, where regret comes too late. This isn't just a bad temper. This is intermittent explosive disorder. And for the people who live with it, it's not a choice. It's a condition. Let's talk about the rage you never see coming, and the truth most people never hear. What is intermittent explosive disorder? Intermittent explosive disorder, or IED, is a mental health condition marked by repeated, sudden outbursts of aggressive behavior, often disproportionate to the situation that triggered them. We're not talking about people who are just hot-headed. This is recurrent, uncontrollable, and often deeply distressing, both to the person experiencing it and the people around them. Imagine your body going from 0 to 100 in seconds. Heart racing, muscles tight, vision narrowing, words flying, fists clenched. And then, it's over. Shame sets in. Regret floods your system. You're left cleaning up emotional wreckage. Again. That's what IED can feel like, and it's more common than most realize. What do these outbursts look like? Someone with intermittent explosive disorder may yell, scream, or curse over small frustrations, break objects, punch walls, slam doors, get physically aggressive, sometimes pushing, hitting, or threatening others, feel completely unable to stop once the anger kicks in. And then comes the crash. Many report feeling remorseful, embarrassed, or even frightened by what they did or said. Outbursts typically last less than 30 minutes. They can happen several times a week, or just a few times a month. But what defines IED is the pattern. Not just one bad day, but repeated episodes that derail relationships, jobs, and daily life. It's important to know, people with IED often don't want to hurt anyone. Their behavior is not calculated, it's explosive, and deeply emotional. What causes it? Like many mental health conditions, intermittent explosive disorder doesn't have one single cause. It's shaped by a mix of biology, environment, and psychology. 1. Brain chemistry and structure studies show that people with IED may have differences in the amygdala, the part of the brain linked to emotion and threat detection, and frontal lobes, which help with impulse control and decision-making. In short, their brains may be wired for more reactivity and less braking power when emotions surge too. Genetics. If a parent or sibling has mood disorders or impulse control conditions, the risk increases 3. Trauma and childhood environment. Growing up with violence, abuse, neglect, or inconsistent discipline can teach the brain to respond to stress with aggression, not as a conscious choice, but as a conditioned response. 4. Co-occurring conditions. IED often exists alongside ADHD, depression, anxiety, or substance use disorders, which can make emotional regulation even harder. This isn't about excuses. It's about understanding what's underneath the explosion. Who does it affect? Intermittent explosive disorder can affect anyone, but research shows it often begins in late childhood or adolescence. It's more common in men than women, and it's frequently undiagnosed or mislabeled, written off as anger issues, a short fuse, or just being difficult. The truth? Many people with IED don't realize their behavior has a clinical name, or that there's real help available. How is it diagnosed? A diagnosis of intermittent explosive disorder requires multiple outbursts over time, often several months. Reactions that are wildly disproportionate to the trigger and distress or impairment, meaning it damages the person's life, relationships, or career. Mental health professionals use interviews, behavior history, and psychological assessments, and often rule out other conditions like bipolar disorder or PTSD. It's not about blaming the person. It's about identifying a pattern and breaking it. Can it be treated? Yes, intermittent explosive disorder is treatable. With the right approach, people can learn to control their emotions, prevent outbursts, and rebuild their lives. Treatment options include cognitive behavioral therapy, CBT, helps people identify triggers, challenge distorted thoughts, and build new emotional responses. Anger management training, not just calming down, but learning how to anticipate rage, pause before reacting, and release anger in healthier ways. Medication, Antidepressants, mood stabilizers, or anti-anxiety meds may help regulate the emotional system. Lifestyle changes. Sleep, nutrition, exercise, and stress reduction all play a role in emotional regulation. Change takes time, but people with IED can learn new patterns and regain control over their lives. How to support someone with intermittent explosive disorder. If someone you love has intermittent explosive disorder, you're probably walking on eggshells. Here's what can help and what can hurt. Do. Encourage therapy without shame. Set clear, calm boundaries. Acknowledge their effort to improve. Learn about emotional regulation strategies together. Don't escalate the argument that fuels the fire. Label them as crazy or toxic. That deepens their shame. Pretend it's not affecting you. Your safety and peace matter too. There's a difference between understanding and tolerating abuse. Support doesn't mean accepting explosive behavior. It means helping someone get the tools to stop it, while also protecting your own well-being. Intermittent explosive disorder is not just being angry. It's a condition that hijacks emotions, damages relationships, and isolates the very people who need connection the most. With awareness, compassion, and the right treatment, people with intermittent explosive disorder can learn to pause before the eruption and build a life that isn't ruled by rage. If you or someone you know sees themselves in this video, don't brush it off. Talk to a mental health professional. Learn more. Take one step toward healing. And if this video gave you value, share it. Because silence only feeds stigma, and understanding breaks it.